Hello everyone, and welcome to our presentation on the total shoulder replacement here at Parham Doctors Hospital. We are your presenters. My name is Victor Chan with Physical Therapy.
I'm Colette Walker from Occupational Therapy.
And I'm Taylor Summer, also from Occupational Therapy.
And without further ado, we're going to go right into our presentation objectives. The objectives of our presentation today will be to learn and understand shoulder precautions, learn basic post-surgery self-care, talk about the sling and demonstrate how to put it on and take it off, learn how to perform your elbow exercise, as well as discuss pain management and fall prevention.
First, we will be going over your shoulder precautions and what you should be doing. When positioning your surgical arm, you will need to keep your arm in your sling and in front of your body. You will be wearing your sling at all times until directed otherwise by your surgeon, with 3 exceptions. Those include while dressing, washing and showering, and when you are doing your elbow exercise. You will also keep ice on your shoulder as directed in the discharge paperwork from your surgeon. Ice is helpful for pain management and for keeping the swelling down. Lastly, do complete your elbow exercise twice a day. This will be demonstrated for you later in the presentation. We will now go over what you should not do. The most important thing you should not do is actively move your arm from the shoulder. You also should not use your surgical arm to push up from any surface, such as when you are standing from a bed or a chair. Lastly, do not lift or hold anything with weight in the operated arm's hand. Your surgical hand may be used for very light tasks while in the sling. For example, you may use it to assist you in opening the toothpaste cap or holding the toothbrush while you squeeze the toothpaste. But do not use your surgical hand to do things like brush your teeth or drink a sip of water.
Next, we will discuss sling management. Your sling should be positioned in front of your body with your forearm parallel to the floor, or with your hand slightly higher than your elbow to prevent your arm from sliding out of the sling. Your sling should support your hand and ideally cover the knuckles. You will wear your sling at all times, including when you sleep. The only exceptions will be when you are dressing, bathing, or completing your elbow exercise. You will wear your sling until your follow-up appointment with your surgeon. They will determine how much longer you will need to wear your sling.
We're going to go over the different parts of the sling here. So there are 3 straps we need to learn about. There's one here that's the most supportive strap, supporting the arm up. The next strap we're going to learn about is the one that comes across the elbow. It starts on the back of the elbow, comes across to the front. It's like a little seat belt to keep your arm from sliding out of the sling throughout the day. The third strap we need to worry about is the waist strap that comes around the body. So if we were going to take this sling off, we want to leave the most supportive strap on for the longest amount of time. So the first strap that I like to take off is the waist strap. So Richard, you can go ahead and undo that waist strap. Perfect. The next strap we're going to come to is the elbow. So we're going to unfasten it from the outside, and I like to tap it right on the pillow so you know where it is when you go to put the sling back on. The third strap we're going to worry about is the one that's the most supportive. So you can either unclip it here, or we can loosen it up and slide it over the head. I'm going to choose to unclip it. Richard, I'm going to have you let your arm just straighten out, and you're going to lean forward so that you're not tempted to bring your arm away from your body. We're going to slide this right across, and then you can stand up nice and tall and let your arm dangle when the sling's off. To put this back on, we never want you to hike your shoulder up or move your shoulder out away from your body. So I'm going to have you lean forward to let the arm dangle. We're going to slide this up until your elbow gets in. I'm going to have you bend your elbow, and we're going to secure the most supportive strap first. We're going to come around here and clip this in. You want to make sure the elbow is all the way in the back of the sling. Instead of having him push his elbow back, instead what I'll do is pull the sling forward to make sure the elbow's all the way in the pocket here. We're going to secure this elbow strap across the front. It doesn't have to be tight, it's just to ensure the arm is not sliding out of the sling. And the third strap we're going to do is the waist strap. I'm going to hand that to you, and you clip it right into the pillow here. And once the sling is on, we want to make sure the forearm is nice and parallel to the ground. We don't want your hand hanging lower than your elbow. That puts you at risk of having swelling in your hand.
Next, we will discuss bathing. Generally, our surgeons use a waterproof dressing for your incision. However, specific instructions regarding when you may start bathing will be provided by nursing before you leave the hospital. When you are bathing, you will be able to take off the sling and let your arm dangle at your side. You will need to only use your non-operated arm to complete all bathing tasks. Because of this, we recommend the use of a long-handled sponge or loofah so you can easily access all areas, including flipping the sponge upside down to wash underneath your non-operative arm. You can wash under your surgical arm by leaning forward while the surgical arm is dangling to create room under the armpit and allow for you to wash with your opposite hand.
When we're bathing, we're going to want to take our sling off and allow the arm to dangle beside our body. For this video, my left shoulder will be the one that I had replaced. We're going to use our non-operative hand to wash everywhere that we can reach. To wash underneath the surgical arm, you can lean forward, allow the arm to dangle away from the body to wash underneath. Some patients have difficulty reaching underneath their non-operative arm. We can grab something like a long-handled sponge or a long-handled loofah, flip it upside down, wash underneath the arm. You can also use the loofah or sponge to reach down to the legs and feet and get the back to prevent falls in the shower.
When it comes to dressing, we recommend a button-down shirt that is one size larger than your typical size. You will dress your operative arm first by leaning forward and allowing your arm to dangle with gravity before pulling the shirt onto that arm, with the non-surgical arm doing the work. Pull the shirt all of the way up at your neck so it is easy to reach when putting in your non-operative arm. Once you are able to move your surgical arm after surgery and it is not painful for you to do so, you may bend your elbow to assist with buttoning up your shirt. When doing this, be careful not to move the arm out or up at the shoulder. We recommend elastic waistband pants or shorts, as you will only be able to pull your lower body clothes up with your non-operative arm. Be sure to wear closed-toed shoes that have a non-slip sole for preventing falls. No flip-flops.
For dressing the upper body, something that buttons or zips up the front is going to be the easiest thing for the patient to get on. For this video, Richard had his right shoulder replaced. We're going to want to start by putting the operative arm in first. So I'm going to have you lean forward, allow the arm to dangle away from the body. We'll slide it all the way up until the shirt is tucked underneath the armpit. Then we're going to put the non-operative arm in. Have you put your arm in here. Slide it all the way up. For buttoning the shirt, he'll be allowed to bend the arm at the elbow as long as he's not lifting the arm away from the body or pushing it behind him. To take the shirt off, he'll be allowed to unbutton. And we're going to start by taking the non-operative arm out of the shirt first. And the last thing to come out will be the operative arm. Once again, lean forward, allow the arm to dangle away from the body, and slide the shirt right off the front.
Next, we will discuss your elbow exercise. The shoulder pledge is a simple exercise in which you are bending your elbow to mimic a pledged position. This exercise is for range of motion so that your arm does not get stiff. It is not for strengthening the arm. You will complete this exercise for 10 repetitions twice a day. We typically recommend completing this exercise when you already had the sling off for dressing or bathing to limit the number of times you must remove the sling throughout the day. On top of this exercise, you may also move your wrist and fingers throughout the day while your arm is in the sling for comfort and to help reduce stiffness and swelling.
Throughout the day while you're wearing the sling, you can move your wrist and finger joints to keep them from getting stiff and help with swelling. You can move your wrist back and forth, get it in little circles, move your fingers in and out. The sling also comes with a ball on it here. If you'd like to squeeze that, that's an option. If this is too firm, you can use a balled up pair of socks, put that in your surgical hand, and squeeze it throughout the day. We'll want your arm to come out of the sling twice a day for an exercise for your elbow. This is to keep your elbow from getting stiff from being in the same position during the whole day. So twice a day, we'll start with the arm hanging by your side. The goal is just to bend up at the elbow, keeping the arm close to the body, and then bringing it back down slow and controlled. 10 repetitions, once in the morning, once in the afternoon or evening.
This is the pain scale that you will use to indicate your pain level, ranging from 0, no pain, to 10, the worst possible pain. You will talk with your nurse about your pain management when you are at the hospital for your surgery. Do expect to have some swelling and bruising in your shoulder and the surrounding areas.
When it comes to pain control, there are other things you can do to help instead of taking more pain medication. We use the statement to stay armed against pain to remember these alternatives. The first alternative is to apply ice. Ice is a great form of pain relief and will assist in reducing swelling as well. Just remember to keep a barrier between the ice pack and your skin. Another strategy is relaxation. This includes things such as meditation, listening to music, or aromatherapy. Movement is next. This includes going for a walk and repositioning using pillows. Next up, we have entertainment. Examples here include engaging in a safe hobby, speaking to loved ones, or watching your favorite TV show. The goal here is to keep your mind off the pain. Lastly, we have deep breathing. Practicing deep breathing with a 3-second breath in, followed by a 3-second breath out for 10 minutes a day has been shown to decrease overall pain levels. So there you have it. 5 alternatives that you can try instead of taking more pain medication. Just remember, stay armed against pain.
Next, we will go over sleeping. When sleeping, you will need to sleep with your head and upper body elevated to approximately a 60-degree angle, mimicking a recliner position. If you have a recliner, that tends to be the most comfortable for patients. If you do not have a recliner, you can prop yourself up with pillows or use a wedge to mimic the same position. You should also place a pillow behind the upper arm to keep it forward on the front of your body for positioning, as well as for pain control while you are sleeping or resting.
For sleeping, we're going to want to mimic a reclined position. The best way to do that, of course, is in a recliner. You want to keep the sling on while you're sleeping, and we want it to stay to the front of our body and not sliding backwards. The way we can ensure that here is to place a pillow, turn it long ways, ask the patient to roll to the opposite side. We're going to place it behind where the arm goes. Another thing we can do is take a pillow, put it underneath where the elbow is. Since she does not have an abduction wedge, we want to place this one to keep it positioned well. So go ahead and roll one more time. We'll place it kind of underneath there and roll back to keep the arm nice and supported throughout the night. If we don't have a recliner at home, we can mimic this same reclined position in the bed using a wedge pillow like we've done here. We can also create that same position using thicker pillows at home. The most important thing for sleeping is keeping the arm in the sling with the arm to the front of the body. To make sure this does not slide backward while he's sleeping, we're going to take some pillows, turn them long ways, and put it behind where the arm will be to keep it positioned to the front of the body. If you don't have the wedge here, we can place another pillow underneath the arm to keep the arm supported throughout the night.
Falls are something that we all want to avoid. Your arms play a crucial role in maintaining your balance, so your risk for falls will almost always increase after a shoulder replacement, as you will be down an arm for a while. Each year, more than 1 in 4 adults over the age of 65 will experience a fall, But there are 4 major ways that we will go over now that you can use to help decrease your risk.
The first way you can decrease your risk for falls is by modifying your home. This can include things such as removing throw rugs and clearing out cords. You will also want to keep your home well lit, including night lights. Make sure you have clear walkways and steps. Make sure you are using a railing when going up and down the steps. Installing grab bars in the bathroom can help with safely getting in and out of the tub, as well as on and off the toilet. Using non-slip mats in and out of the shower or tub so you don't slip. And lastly, try to keep items that you use on a day-to-day basis within reach. Getting assistance for more difficult tasks will also help to decrease falls. This includes things such as feeding and walking your pets, cooking and preparing meals, dressing or managing the sling, completing chores, and running errands in the community. Next, we will go over our stand, stop, and check policy. Exactly as it sounds, when you are at home and stand up, stop and check if you feel dizzy, lightheaded, faint, or weak. If you do feel any of these symptoms, you will want to sit back down and rest until these feelings pass before trying again. Remember, don't rush. Safety first. Lastly, avoiding risks will also help to decrease your risk for falls. This includes using a balance device such as a cane or Hemi walker if it was recommended for you. Avoiding wet surfaces when at home or out and about. Wearing well-fitting and non-slip shoes. Using your glasses and avoiding uneven or steep areas.
Due to pain medications and anesthesia, constipation is a common occurrence. You will need to take a stool softener to make it easier for you to go to the bathroom while you are on these heavy pain medications. Other things that will help include eating lots of fruits and vegetables or fiber in your diet and drinking plenty of water, about 6 to 8 glasses a day. Go for short walks and frequent walks, starting inside your home until you have enough energy to go outside. When the weather is nice, if you have a flat surface, walk on the flat surface, trying to avoid grass or gravel when first starting out. Some people also find it helpful to limit caffeine. Most importantly, if you have not had a bowel movement within 3 days of going home, call your surgeon. This concludes our presentation on the total shoulder replacement. We hope that you have found this presentation informative and feel better prepared for your upcoming surgery. If you do have any questions, please do not hesitate to reach out. Thank you for your time.